So in this session, we'll actually talk through what the OT process looks like in the hospital setting. And I'll be focusing on working with adults with physical health conditions within an acute ward. So not peds, not mental health, not a rehab ward even, although there's still likely to be lots of transferable skills and principles that I'll cover. So we'll start with going through what a typical day could look like, including both the clinical tasks that you complete with clients and the non-clinical admin tasks. So you may not have the same sort of amount of reports to write or KPIs to hit like you might have in an NDIS community role, but there are still admin tasks that you need to do. Then we'll get into the main part of the session, which is what the OT process will look like, and we'll use the Canadian Practice Process Framework, which hopefully will at least be vaguely familiar to you, and we'll go through that in step by step what an OT might actually do in an acute hospital setting. So I'll give you a super quick run through now. So step one is the enter initiate, which is around accepting the referral, ensuring it's appropriate for you to see the patient, and then clarifying exactly what the team needs you to do. But often that focus really is around assisting with discharge planning. Step two is called set the stage, and this is usually when we do our initial assessment to scope out whether the patient is at baseline, what level of function they need to reach to be ready for discharge. And while normally this would be the phase to start rapport building as well, sometimes we only actually have one session with a client to do this, so it can be a little bit tight. Step three is called assess evaluate, and this is where we will do like deeper dive assessments. So it could be functional mobility assessments, self-care assessments, functional cognitive assessments, sometimes standardized assessments, as well as liaising with other team members and the patient's family as well. Step four is to agree on the objectives and plan, which is usually centered on what do they need to be able to do to be safe for discharge. But we may also need to set some expectations about what's non-urgent and outside of our scope as that acute hospital OT, but what we can also refer on to for another OT to take on after the discharge from hospital. So it could be things like non-urgent home modifications. Step five is to start the actual therapy, and this could involve lots of different things. It could involve practicing transfers or self-care, sometimes with an allied health assistant to boost practice. It could be providing education on things like falls prevention or actually prescribing and arranging some equipment for discharge. Step six is called monitor and modify, and sometimes we have a one-off session only, and this bit doesn't really happen. But for those admitted for longer, this involves regularly reviewing their progress, liaising with the team if those discharge goalposts need to change at all. And then step seven comes when the patient has finally reached the point when they're ready for discharge. We do a final check to make sure that they've reached that required level of function for discharge. All the arrangements have been made and check whether there's any further OT needed once they do leave hospital. And then the final step is step eight, which is conclude and exit. And this is where we refer on to the client for any outstanding OT issues, ensure they know who to contact if things don't really go to plan, and otherwise we're documenting safe for discharge, no further OT required. So I'll go through that a lot slower with a case study as well. And that case study will be of an older person admitted to an aged care ward. And then there'll be two quick fire case studies as well that highlight how that OT process can look a little bit different depending on the client's needs and the ward that you're working on. And then as always, there'll be some practice homework tasks for the keen beans. But as usual, lots to get through. So we'll see how we go